And a bill that would make it illegal for doctors to help patients take their own life had its first hearing at the state capitol today. House Bill 284 would open doctors up to possible homicide charges if they were to comply with patients' wishes and speed up a patient's death by prescribing a lethal dose of medication. Now, assisted suicide is not explicitly legal in Montana, but a ruling in 2009 Montana Supreme Court case Baxter versus Montana created what some call a loophole that allows the practice. Now, the bill's sponsor, Republican Carl Glimm of Kyla, compared physician-assisted suicide with Montana's high suicide rate, suggesting it sends the wrong message to people about suicide as a solution.
Every session, this body takes up legislation and spending bills to try and curb the suicide frequency in our veterans, our youth, and our Native American populations. This bill is an opportunity to send a consistent message about suicide from young to old, from healthy to sick, that it's not a good option.
Now, some of those who spoke in opposition to the bill see things differently. Roberta King is the daughter of Robert Baxter, the plaintiff in the Montana Supreme Court case that allowed physician-assisted suicide. And she testified at today's hearing, saying the choice should be left to the patient, not the government.
People in Montana believe that we know how to take care of ourselves without government interference. We trust that our doctors will give us the best possible medical advice, and the Montana Supreme Court was right to agree.
Now, a similar bill to outlaw physician-assisted suicide failed in Montana during the 2017 legislature.